Rayborn, and this is Deliverable 5, optimizing the use of data to inform healthcare decision making. For this deliverable, I am talking about traditional EHR systems without clinical decision support, or CDS, as an outdated system. Just some background. Traditional EHRs, or electronic health records systems, have historically not come equipped with clinical decision support, also known as CDS. A traditional EHR system is used to capture and store patient data such as medical history, lab results, diagnoses, medications, and treatments. Here at our facility, our current EHR is a health information system that captures and processes patient data but does not optimize the use of that data to inform healthcare decision making. Our system does not integrate decision support tools or advanced analytics. Because we are not using our EHR to its full potential, I am proposing we amend our current EHR to enhance it with clinical decision support. Typically, traditional EHR systems are primarily designed to organize and manage patient records in a digital format, making it easier for healthcare providers to access and update. However, when such systems are not equipped with advanced decision support capabilities, predictive analytics, or real-time alerts, they fall short of optimizing data that can actively inform healthcare decision-making. Data capture in traditional EHRs, patient data capture. The system captures demographic information, clinical notes, vital signs, laboratory results, medication orders, and imaging reports. It does have data storage and retrieval. All the captured data in traditional EHRs is organized in a structured, easily accessible format. And healthcare providers can look up patient data quickly, which improves efficiency in documentation and reduces the risk of data loss or fragmentation. So why this system does not optimize data for decision making? It does lack, obviously, CDS or clinical decision support. The system does not automatically flag potential issues like medication interactions, abnormal lab results, or other clinical concerns that could alert healthcare providers to possible patient risks. For example, if a nurse orders a drug that could interact with a patient's existing medication, there are no alerts to warn them. The system does not provide real-time evidence-based support decision support tools, that help guide healthcare providers through best practices or appropriate treatment options based on patients' unique clinical profiles. Again, it does not have predictive analytics. The system does not use data to forecast clinical events such as the likelihood of a patient deteriorating, developing complications, which can lead to missed opportunities for early intervention. There is also no integrated tool that uses historical data or real-time trends to assess patient risk or prioritize care based on severity. Continuing on, these systems have limited reporting and data utilization. The system may store extensive patient data but does not generate insights or reports that can be used for improving care delivery. The data captured within the system does not facilitate automated data analysis. Healthcare providers may need to manually analyze the data or use separate tools to generate reports. Examples of this include tracking patient progress, nurse workload, and/or identifying gaps in care. This reduces efficiency and limits the ability to intervene sooner. The inability to support personalized care occurs because there is no decision support. The system does not offer tailored recommendations for individualized patients. There are no available data-driven suggestions or customizations for specific needs of each patient. Treatment plans and clinical decisions are heavily based on the provider's knowledge and expertise. The traditional system does not learn from the data obtained to improve its recommendations or adapt to the evolving needs of the patient population, as opposed to systems with CDS. Traditional EHR systems, there is no continuous learning, unfortunately. Traditional EHR's impact on healthcare decision making. We have noticed delayed interventions because the system does not proactively alert healthcare providers about critical issues or offer actionable recommendations. This can make decision making slower. This can also result in unwanted delays in care. We have identified missed opportunities for preventative care. Without the use of predictive analytics, there is a higher risk of missing opportunities to identify patients at risk for further complications. These risks can include falls, pressure ulcers, hospital readmissions, and more. And lastly, we have noticed inconsistent care delivery. The absence of CDS and evidence-based recommendations can result in variability in care delivery, as care decisions are heavily reliant on individual providers. These decisions are mostly based on their expertise, experience, and individual interpretation, rather than data-driven insights generated by CDS systems. According to Burge et al., new methods such as the use of natural language processing, or NLP, can enhance data capture by extracting relevant information from unstructured clinical notes. This allows for a more comprehensive understanding of the patient condition. Leveraging EHR with CDS for capturing, processing, and visualizing data in new ways can significantly enhance decision-making in healthcare. Real-time data feeds, including data from wearable devices and remote monitoring tools, can be integrated into EHR systems, providing continuous flow of patient information for better informed decisions, according to Sutton et al. In 2020. These CDS systems enable real-time, evidence-based, and personalized care. Also per Sutton et al. In 2023, data visualization tools such as interactive dashboards can present complex patient information in a more digestible format. CDS dashboards that combine EHR data with decision rules can present alerts, reminders, and guidelines, helping clinicians make evidence-based decisions in critical care settings such as ICUs and EDs. These innovations also improve clinical outcomes, reduce errors, and optimize healthcare delivery by providing clinicians with timely, accurate, and actionable information. An example of this as a visual representation is patient vital signs over time, or risk stratification scores. How to optimize our current EHR, the addition of CDS. We should first start by integrating CDS tools. Implementing a CDS addition to our EHR, we can provide real-time evidence-based alerts, reminders, and recommendations at the point of care. We can have a positive impact on decision-making and outcomes, including reduced medication errors, improved clinical accuracy, promotion of preventative care, and improved patient outcomes. These tools should be tailored to each clinical setting, offering suggestions based on a patient's current condition, history, and risk factors. We should also incorporate predictive analytics. These are used to analyze patient data to identify potential risks before they occur. CDS systems use algorithms to predict patient outcomes such as readmission risk, sepsis, falls, and more, based on historical and real-time data. CDS will also help clinicians follow best practice guidelines. Early alerts for deteriorating conditions enable timely interventions that can reduce complications and improve morbidity and mortality. They also work to better inform and identify early interventions, which can lead to fewer adverse events and increase patient safety. And use of CDS can also help us better allocate our resources. Predictive models help optimize staffing by forecasting patient needs and preventing overcrowding. Continuing on, we can implement personalized and adaptive care pathways. By developing personalized care pathways that adapt to individual patient needs and preferences, our EHR can provide personalized recommendations based on patient data. These pathways also provide consistency in care by ensuring all clinicians follow the same evidence-based protocols. Furthermore, patients will receive individualized, responsive care, which improves patient satisfaction and long-term health outcomes. These pathways should evolve as new data becomes available, such as clinical data, updates, lab results, or progress notes. Use of data for continuous quality improvement, or CQI. By leveraging real-time analytics, we can monitor clinical performance, identify care gaps, and track health outcomes at both the individual and population levels. The real-time data generated by CDS provides insights into areas of improvement, such as reduction in readmission rates and improvement of pain management. This data will also optimize care delivery by continuously analyzing patient outcomes. Lastly, this addition will have a positive impact system-wide with improvements in care processes that result in better operational efficiency, reduced costs, and improved patient outcomes. The CQI will also encourage our organization to continue to make data-driven decisions to enhance care quality, and we will also have a better alignment of patient needs and improved resource utilization. In conclusion, optimizing our current EHR by adopting CDS can significantly enhance decision-making. This is done by integrating advanced technologies such as predictive analytics and real-time communication tools. The use of data generated by CDS leads to more personalized, coordinated, and timely care, which ultimately improves patient outcomes, reduces costs, and enhances the overall efficiency of health systems. By leveraging this data to its fullest potential, our facility can shift from reactive to proactive care, fostering better health outcomes for patients and more effective use of resources across the system.